yellow fever, malaria, encephalitis, West Nile virus, even death. These are some of the little gifts you can get when a mosquito comes to visit you. Good evening and welcome to Medical Chat. I'm your host, Stacey Lambright. I am a licensed vocational nurse and I have been one for about 14 years. I pride myself in the educational program at the facility that I currently work for. Today's topic of conversation is the culicity, or most commonly known as the mosquito. According to the website mosquito.org, the life cycle of a mosquito from egg to adult takes about 1 month. Males only live in for about 1 week. Females can lay up to 300 eggs every third night. That means 3,000 mosquitoes from just one mosquito. It can take up to 10 to 14 days to hatch depending on temperature, humidity, and climate. Mosquitoes need water to lay their eggs. Everyone must do their part when it rains to inhibit the spread of mosquitoes. After it rains, please make sure you go out into your yard and dump all stagnant water that may have collected in old flower pots, bowls, or swings, or any item that may hold water and be a breeding ground for mosquitoes. Ugh. Even though I mentioned a couple of diseases when we first started, our main focus tonight will be on West Nile virus. According to the Center for Disease Control, West Nile virus is a seasonal epidemic in North America that flares up in the summer and continues it in the fall. Mosquitoes are more active during the dusk and the dawn hours. So if you have to get outside, please make sure you wear long sleeves, pants, and even insect repellent. You may be asking yourself, what are the symptoms of West Nile virus? According to the CDC, 1 out of 150 people are infected with the West Nile virus and may not even know it. Some may even develop serious symptoms. Some symptoms include high fever, headache, neck stiffness, stupor, disorientation, coma, visual impairment, numbness, paralysis, and even death. Symptoms last for about several weeks. Approximately 80% of people, that is 4 out of 5 who are infected with West Nile virus may not even be symptomatic. People over the age of 50 are at higher risk for getting West Nile virus, with symptoms occurring 3 to 14 days after being bitten by an infected mosquito. You can be tested for West Nile virus in one of 3 different ways. The first way would be a blood test, where they draw some blood out of your arm and they check for an RNA factor, which is an indicator of West Nile virus. The second way would be to do a spinal tap, where they take some of your blood from your spinal column with a needle. They inject a needle into your lower lumbar where they can collect some spinal fluid, and they leave the little sheath inside your lower lumbar, and it drips into a container where then it goes to the lab for testing. The third way would be with an MRI, where they check your brain for inflammation. All in all, if you forget anything and everything that I said tonight, please remember the word stop. Spray to optimize protection. And that way it decreases your chance of getting any kind of diseases that are carried by mosquitoes. Furthermore, I would like to thank my cameraman and director, Josh Lambright, for videotaping me tonight. I really hope this has been a very informative speech for you guys and that you learned a lot. Thank you for tuning in.